recent curriculum changes have introduced reduced hours for basic science teaching and greater emphasis on technology-enhanced learning. These changes have affected undergraduate ophthalmology teaching, which historically is an underrepresented subject in the medical curriculum already. This includes ocular anatomy, which remains fundamental for clinical and surgical graduates. This is especially the case since it informs 1. Clinical theory and identifying the correct diagnosis in practice. 2. It allows for a thorough ophthalmology examination to occur. And 3. It allows progression to higher postgraduate and surgical training where anatomy becomes the crux of practice. The aim of our study is to investigate the impact of 3D interactive anatomy software on the learning potential in ocular anatomy at an undergraduate level. An online ocular anatomy lecture was run on a webinar platform, Zoom, exploring the use of BioDigital, a commercial three-dimensional interactive software that is used to teach virtual anatomy. Students were quizzed on clinical and surgical theory before and after each lesson, and then students were allowed to access this software for 2 weeks before filling out a perception survey. We noticed in our results that a significant improvement in mean knowledge gain was observed for both clinical and surgical quizzes, and 100% of the students agreed that the 3D anatomy software is an effective method of teaching ocular anatomy. 60% even went as far to say that this would replace traditional methods of teaching anatomy. When they were asked what they like about the software, students stated that it was easy to use, interactive, visually appealing, and ultimately allowed them to appreciate the 3D anatomy of the eye.